Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. We'll be off for Memorial Day and return on June 1st with Season 6. This summer, we'll continue to talk about living with COVID and the shift from pandemic crisis to endemic virus. We'll also continue to follow breaking news around new variants, the future of reproductive health and the Supreme Court, and humanitarian crises in Ukraine and around the world. We'll look at other urgent public health issues, including racism, gun violence, mental health, climate change, and overdose. And of course, we'll continue to cover the need for investments in public health infrastructure and surveillance for future pandemic threats. As we wind down Season 5, we have a few thank yous. First, huge thanks to our interns, Crystal Allen, Hannah Bennett, Maisie Conrad, and Caroline Wang, who bring fresh ideas and much needed support for the podcast. We'd also like to thank you, our listeners, for sharing your ideas and questions and for downloading this podcast more than 7 million times. We appreciate all the great ideas and questions that come from our listeners, so keep writing to us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu. And thank you for being part of this podcast.
Today, in the wake of yesterday's massacre at Robb Elementary School in Uvalde, Texas, I speak to Dr. Cass Krafasi, the Director of Research and Policy at the Johns Hopkins Center for Gun Violence Solutions. Let's listen. Dr. Krafasi, thanks so much for joining me to talk about the events in Uvalde, Texas. When did you hear about what happened?
I was wrapping up a meeting yesterday in the afternoon around 4 p.m. or so, and both Daniel Webster and Josh Horowitz, co-directors, were in the office, and we were touching base on something else, and our phones started going off with updates of the news coming out of Uvalde.
And, you're sitting with people, and you yourself are someone who studies, works on, tries to stop events just like this. What were the thoughts going through your mind?
I mean, honestly, my first thought was not a school, not again. And we waited 10 days. The Buffalo shooting was the worst that we'd seen so far in 2022, and we barely made it 10 days before we had an even worse shooting, this time with children. I mean, no loss of life is acceptable, but little kids in their elementary school classroom, that's something that's really hard to hear.
Now, as you're looking at the facts as they're coming out, what is striking you about this situation?
Some of the things that are immediately coming to mind are the shooter very recently turned 18 just a few days ago, or a couple of weeks ago, bought these guns shortly after that, which was just a few days before the shooting. So if there were other policies and procedures in place to put more processes, like a waiting period, for example, or having minimum age for buying these kinds of firearms, we might not have seen this happen. So many things went wrong in order for this to have happened. And we think about the rights we grant individuals at 18 and the privileges we grant individuals at a later age based on what we know about risk. We know that 18 to 20-year-olds are at the highest risk or some of the highest risk for causing harm with firearms to other people, sort of causing gun violence. But in many places, it is too easy for these folks to buy firearms, either through legal sales from licensed dealers, and also there are states that allow people to buy these guns through private sales, where they can get them at a younger age than they might be able to under federal law.
Now, you study measures that can reduce the chance of a horrific shooting like this. What are the other things that, you wish had been in place in Texas?
I would have loved to have seen license that is required for purchasers before they go buy a gun. We know from some of the work that was led by Dr. Daniel Webster and colleagues at our center that requiring prospective purchasers to get a license before they buy a gun is associated with reductions in fatal mass shootings. Restricting magazine size is also an important factor. We know that when we have either handguns or assault-style rifles that can accept magazines that hold a large number of rounds, it makes it very easy to shoot lots of rounds, meaning you can harm many people without having to pause and reload. Another important policy that could have been effective in this case in particular, based on what we're hearing coming out about the perpetrator, are extreme risk protection order laws. Often in cases of mass violence, there is leakage. People talk about perhaps wanting to harm themselves or others. They might talk about committing some kind of act. And in that case, an extreme risk protection order can temporarily separate someone from their firearms during this time of crisis or during elevated risk. Had that been in place, even though this person had just purchased firearms, that could have been a tool that could be used to separate this perpetrator from their firearms and keep this from happening.
So it's not a story about not knowing what to do. It's really a story about knowing what to do and not doing it.
We have this really important misperception in our country that we have no idea how to reduce gun violence. And that gets perpetuated in the media. It gets perpetuated by the gun lobby. We get distracted by comments around mental health or mental illness. And we don't focus enough on the firearms and access to firearms and how we can separate risky people from those firearms. We know right now that we have solutions that exist at the state level that can be used to prevent these type of incidents, as well as the violence we see every day in communities and suicides. We just choose to not move forward on those things. We have not seen action to effectively advance these policies at the federal level. And in many cases, we're seeing the reverse trend. We're seeing a loosening of laws at the state level that is harmful to our communities.
Now, some people say, the solution is for more people to be armed, but both in Texas and in Buffalo, there are stories of people trying to engage with firearms and not being able to stop the shooter. What does that show to you?
If firearms everywhere made us safer, sort of lots of guns in the hands of lots of people, we would be the safest place in the world. We have more guns than people in this country, yet we are the only country that continues to experience exceptionally high rates of firearm homicide and fatal mass shootings that are occurring with extreme regularity. As of yesterday, there had been 212 mass shootings already in the U.S. We're on pace to keep going if the trend that we're seeing so far this year is any indication. So it's not that we need more guns in more places. In fact, when we see expansion of civilian gun carrying, for example, make it easier for people to carry guns around in public, we see increases in crime and violence, and we see increases in shootings by police. It is the sort of wrong direction to say we need more guns everywhere. We need better implementation of our policies to make sure that the guns that we have don't get into the hands of people who shouldn't have them.
I really don't like when people are asked to predict what's going to happen after a shooting. And so I'm not going to ask you to do that, I think.
Thank you. I appreciate that.
I'm going to ask you, though, what you would hope to see happen. What kind of mobilization and understanding do you think should come from a situation and catastrophe like we've seen in Uvalde?
I would like to see our policymakers stand up to the gun lobby that has had a stranglehold on action, whether at the state level or the federal level. I hope to see people who are as outraged and disgusted and tired and just sick, absolutely sick as I am, calling their policymakers, calling legislators and saying, what are you doing to address this issue? What are we doing in our state? Do we have extreme risk protection order laws? If yes, why are we not implementing them effectively? If not, let's pass them. Do we have laws that are requiring people to get a license? If not, why not? Where do people stand? Because thoughts and prayers are not going to solve this problem. We've been thinking and praying for a decade since the Sandy Hook shooting in 2012, and we have not seen substantive action. And people need to be motivated and activated to be calling for the changes that we know are effective to reduce this problem.
Thanks. I imagine, as someone who studies this, these are particularly difficult moments. You have had different kinds of successes in improving what works and in working at the state and local level. And then you see something like this, how are you going to be processing what's happening?
It's really challenging, to be totally frank. It is hard to see not just shootings like this, which are just absolutely terrible, but every day in Baltimore City and cities across our country, high rates of gun violence in our communities, particularly rural communities, high rates of gun suicide. We don't have to have this problem. We know that there are things that work. And so despite my frustration and anger, I try to be optimistic because I know that we have solutions right now, programs and policies that work, and we need to be advocating for these policies. The core of public health is making change, and you cannot make change unless you're willing to advocate for the things that you know work. And so it's important to me that we take however we're feeling, frustration, rage, disgust from this shooting, and that we empower ourselves with knowledge so that we can advocate for the things that we know work.
Cass Kripacy, thanks so much for taking some time to talk to me today.
Absolutely. Thank you for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.